So tonight's program is Understanding Alzheimer's and Dementia with Dr. Carol Stevens. Dr. Carol has worked as a psychologist for over 35 years. She is currently on a mission to increase community awareness about changes in thinking and memory in older adults and the grave importance of early identification and intervention. Her goal is to assist older adults and their families to be intentional in planning for a future with quality of life until the end. In her psychology practice, she specializes in treatment of depression, anxiety, insomnia, and mental health issues in adults, seniors, and families. Please join me in welcoming Dr. Carol.
Thank you, everybody. I so appreciate you all coming today. I know that this is a very touchy subject, and somebody said, where are the guys? Like, don't guys get Alzheimer's? And I want to tell you, yes, guys get Alzheimer's, but women are almost twice as likely to get Alzheimer's as men. But there are a lot of guys out there with Alzheimer's, and you know, we're in Idaho. There are rugged individualists amongst us, and probably a lot of us women are like that too. But I appreciate you all coming, and thank you to the library for making this an important mission. I am happy to find people who want to make my mission their mission, is better understanding what's going on with people. So I want to start by asking all of you if you would just share with me, not a whole big story, but just simply why you decided to come today. Because when I think about this, you know, I know that people would probably rather, you know, come to a class, you know, on flower arrangement or something a little more fun. And now and then I think I should try to be more of a comedian or maybe start with a joke. But what I want to know is, like, what compelled you guys to come here? Because you probably didn't just say to yourself, well, that looks interesting, I'll go. You know, probably there's something going on in your life or in your midst, in your family, in your social circle that makes you a little more interested in knowing more. And I'm just curious to hear why you came today. Can a couple of you tell me why you came today?
I'm sorry. Shout at you. I came because I'm a volunteer for the Senior Center for Meals on Wheels, and this is about some of our population that we need to know things and resources.
Yes, okay. So you want to take better care of people.
And I have a daughter whose father, my first husband, is now in care with dementia. And it's been very traumatic for my daughter to deal with it. Extremely.
Okay. So hopefully, Kathy, hi Kathy, are you watching? No. Hopefully, no. How about somebody else?
My mom had Alzheimer's and she died with Alzheimer's. So she took it all the way to the end, and that was pretty painful to watch, but I'm just fascinated to learn about it as much as I can, and I will be doing Wheels on Meals one of these days too. Anyway, so it's just an interesting topic. I just think we should all know about it, so just to be prepared. We just don't know what's going to happen.
So you'll be hearing today kind of through your story and your history with your mom and that experience. So maybe you'll connect a few more dots today. Anybody else? Anybody else have?
My mother also had Alzheimer's and died with Alzheimer's, and I was a caregiver and cared for her. And I'm a retired hospice nurse, and so just more education, I think, is important for everybody out there so that we can care for our loved ones the best of our ability at the end of their lives. I think education is the key right now.
Fantastic. Are you still doing hospice work?
No, I'm retired.
Okay.
Yeah.
We need you.
I know.
You don't look that old. It might be time to get back in there. Thank you.
Hi. I am have been working in social situations all of my career. I'm retired. I'm almost 80. I have been recently diagnosed with, and I can't remember what she called it, but something like early Alzheimer's. And I understand at 80 I'm going to be forgetful, just without that diagnosis. And at first I thought this was the end of the world. And then I decided to quit for, feeling sorry for myself and trying to help people around me understand that my behaviors often are related to my forgetfulness. And so I'm trying to tell people, now I'm on this wagon of saying, I forget. I am so good at forgetting. And, they understand my behavior more, and hopefully they understand others' behaviors around them as well. So I'm sort of trying to influence the community about why people who are 80 or whatever age do some of the things they do, take that into consideration and not be turned off by it. That there's nothing I can do about that at this point.
Right. Well, that is beautiful. I love that you are doing that. Part of why I'm doing this is I feel like we need to educate our community that Alzheimer's is all around us and it's not going anywhere. And just like learning to live with an immigrant population coming into our community, it's a good thing to think about, well, maybe we should learn a little Spanish. Or maybe we should think about learning a little bit about their culture. I mean, there are going to be a lot of people as time goes on. I mean, look at the population in this community. There are a lot of older people. I'm 69, and I feel like I'm kind of a youngster here, which is good. But, I think the more that we can bring this stuff out into the world and present it in a way. I mean, I'm just thinking there was a show years ago called Ally McBeal, and when she got stressed out and upset, she had a song that she sang, and she had a song and a dance that she sang. And I think we need a little Alzheimer's song and dance, like, this is just part of the deal, and get used to it, guys, and love me anyways. I don't know if anybody remembers that show, Ally McBeal. Well, so anyways, I'm here today mainly to talk to you about literacy. Since we are here in the midst of our library system, literacy and learning the signs and symptoms of Alzheimer's and dementia is really, really critical. And I want to help the community learn what to look for and how to deal with it differently. And the next talk is going to be about behavioral issues and kind of how to deal with communication and how to read people differently, because it's a different language. And you can either look at people and act, like they're a nutcase, or you can say, this is what happens as a lot of people age, is that we develop what is called neurodegeneration. We have this little 3-pound thing of jelly and brain up here with 100 billion nerve cells. And those 100 billion nerve cells in all of us are degenerating, but with certain diseases, they degenerate more rapidly. And Alzheimer's, unfortunately, is one that has significant degeneration with time. So what I want to do with you today is improve your literacy and support the library in doing that as well. So the behavioral signs and symptoms of older adults are indicators that something is wrong, that older adults with Alzheimer's, they're indicators. And what we need to do is look and learn about those indicators. And I just want to hear from some of you, are there things that you have noticed in people? Are there things that, like you're talking about, having those memory episodes where you just, kind of kindly say, this is normal, this is it, like, learn from me. Are there other symptoms that people see, signs or symptoms that you think, well, I think that's maybe part of dementia? Anxiety. Right. Yeah. Yep, I think especially early dementia, when people sort of know that there's something going on and they just can't stay on top of it. And I mean, all of us have that experience. For me, preparing these presentations and having to use a PowerPoint and a computer, and I mean, I realized, like, first of all, I was never good at that stuff, but now I'm really not good at it. And it requires a huge amount of brain power and connectivity to be focusing on these things that you don't know how to do. I mean, I was sent a long email about how to launch this presentation, and I looked at it and I just said, nope. Like, I'm not even gonna go there. So I came over and I talked to Denon, and we were successful. But I'm sure that all of you have those experiences where things in the past that you sort of thought, oh, I could do those in the past. Like maybe you're finding that the things are not quite as easy, or that you just decide you're just not going to go there. And that's okay. So anyways, we're looking for literacy. And one of the things that I really want to work on all of you practicing, and those of you who have been to my previous talks have heard this, but I'm going to say this every single time I speak, because I want it to sink deeply in. And it's not that I don't remember that I told you this before, it's that I want to tell you again. And that is that I want you to say, I'm concerned that your thinking is not as clear as it used to be. So let's all say it. I'm concerned that your thinking is not clear as it used to be. How does that feel to say that? Creepy. What's creepy? Right.
And then you can go forward and come up with some jokes.
You can come up with some jokes.
So just you got to get through it to figure it out.
Right, right. But in our community, there's this, there's just this terrific stigma about Alzheimer's. Now, somebody in here came up to me and immediately told me I have Alzheimer's. But that's not the norm, and you revealed that you're having some cognitive issues. It's not really the norm for people to do this. People really want to hide it. And more than people want to hide it, people don't want to deal with it at all. So they want to pretend it's not there. And that pretending it's not there, I think, sort of in our culture and in a community where there are a lot of super smart, super educated people, it feels kind of criminal to say to somebody, geez, I'm concerned about your thinking. You feel like you're just being a jerk. And what I want to say to you today is that there is a diagnosis called anosognosia. Maybe you've heard me say this before. But what this means is that people do not recognize that they're having deficits. They don't know that there is something wrong. That is part of dementia. Probably 50% or more people who have dementia really don't know that anything is wrong. And when you think about kind of how we live our lives, we all get out of bed in the morning, we put our feet in the ground, and we start to self-monitor. I sort of say, do my feet hurt today? I say, what day is it? What's the weather like? What am I doing today? Do I have to take a shower? Should I wear a little makeup today because I'm going to be on a video? All day long, I am self-monitoring. I'm paying attention as I stand up here. I'm going to be self-monitoring, watching a video later, but I self-monitor. I want to make sure that I'm trying to keep myself on track, that I'm saying what I want to say to you. Don't you all self-monitor all day long? And people with dementia lose that capacity you know, in some ways it's sort of like you've got this person on your shoulder that's watching you and saying, don't say that, you know, like you don't want to say that out loud. Have that thought, but don't say it out loud. People with dementia at a certain point don't have that ability to self-monitor and self-regulate. But they don't recognize it. So, you know, we want for people to pay attention to what's going on with them and go to the doctor and have a conversation, but that rarely happens. My guess is that if we ask doctors, how many people come in and say, I'm worried about my thinking, it's really slim. When you think about the people you know, do they go to the doctor? Have any of you said to your doctor, I'm worried about my thinking? You have. Yes, yes. No, it's very hard to get diagnosed, and a lot of people don't get diagnosed. And again, that's part of the reason why I do this, is I really, truly believe that getting a diagnosis and knowing for sure what is wrong is critical, because there are a lot of other things that manifest like dementia, depression. People who have severe depression seem like they have dementia because their thinking is so muddy. I mean, when you think about times in your life when you've been down in the dumps, like most of us have had some kind of experience where we just feel like, ugh, like I can barely focus, I can't concentrate, like this isn't really the way my mind is. So people with serious depression have serious cognitive issues. A lot of people who are depressed, who are readers, stop reading. Reading a book, you know, reading a book takes a lot of focus and effort, and you got to remember what you read in previous pages and chapters. So a lot of people quit reading. So with depression, it manifests like dementia. Now, you don't want to have a diagnosis of dementia if you're depressed. You want to be treated for depression. You want to make sure that you get the right diagnosis. And the only thing that's going to save you from this is to make sure that you see a doctor and that they explore deeply. You know, they do a lot of lab testing. Sometimes they do a brain scan. They do a neurological exam. They do psychological exams in theory. But one of the things that really is important is to ask for it, is to say, you know, I'm concerned about my thinking and I really want you to evaluate me. A survey was done of primary care doctors, and 96% of the doctors said that they felt that it was really, really important to assess older adults' cognition. 40% of the doctors assessed for people's cognition. So what they think is important and what they actually do are two different things. And I'm not here to rat on the doctors, because, I mean, most of them don't have enough time to, you know, meet the needs of the patient who's sitting in front of them with a presenting problem. But for us as a community, if we're going to sort of change the way we're approaching this by being more involved in stepping in and caring with other people, maybe taking a friend to the doctor and saying, we really need for you to do some cognitive assessment, some extensive cognitive assessment. You know, maybe if you had somebody else with you that pushed that issue further. I mean, I really think that a thorough evaluation is critical to know what's wrong. I've seen people who have gone off their thyroid because their memory gets a little bad and they stop taking their thyroid, and 6 months later their thyroid levels are through the ceiling and they look like they have Alzheimer's. I saw a person whose house was sold and she was put in a locked dementia unit. And then they discovered that she was profoundly hypothyroid. They got her back on her thyroid and she was better. That was a case that I'll never forget because I thought, you know, this is like somehow people think that if there's something wrong with your thinking, it's always dementia. It's not always dementia. I mean, here's a good piece of news, is it's not always dementia. There are many things that are treatable. So if you or the people around you are starting to exhibit symptoms, you got to step in and say, let's go get a thorough assessment. It's hard to get a thorough assessment. And how many of you, when you've gone for your Medicare wellness exams, I'm assuming we're all old enough for that, have they given you a cognitive assessment? Have they given you memory tests? How many of you have had a memory test? Not remembering, we don't know if that's a yes or a no. Well, but isn't this, you know, this is supposed to be a part of a Medicare wellness exam. So if you have a Medicare wellness exam, as much as you hate having your memory tested, ask your doctor to test your memory. You know, they're hell-bent on getting you on that scale and getting your weight, and I want to avoid that weight more than anything, even more than the memory test, I think. But they're going to get you on that scale. And somehow, I think they need to get going with, and actually there was an article in one of the journals that I read recently that said that really they need to crank up doing cognitive assessments on everybody who goes into the doctor after age 60. Because it needs to be detected, and people, as I told you, this anosognosia, people are not going to self-report. They're not going to say, doctor, my mind isn't working like it used to. I mean, rarely. So somebody has to do that job, and who's going to pick up that job? I mean, you are my recruits of people who are just going to step in a little bit. If you're concerned about somebody, just step in a little bit. Okay, well, so let's get to this Alzheimer's Association presentation. Is this going forward? Oh, wait. If I just go forward, am I? Oh, Denon. Here we go. Just push the forward button? Oh. Okay, so what we're going to do today briefly is compare Alzheimer's and dementia. We're going to recognize how Alzheimer's affects the brain. We're going to list some risk factors of Alzheimer's disease. I can't see this here. We're going to identify the stages of the disease. We're going to recognize some of the FDA-approved treatments that are available, describe that scientists are working to advance research. I mean, the good news is that there is a lot of effort to get some medications online and get some treatment for this stuff. And I mean, watching what happened with COVID and how quickly that happened, it made me feel more hopeful about getting the treatments that people need. So, and then we're going to just talk about the resources with the Alzheimer's Association. No, what did I do with that thing? Oh, you got it. Oh, God.
Careful not to slide this through. You want that.
Okay. Okay. It's a real disease, and it's far too common. Alzheimer's is a normal part of the aging process. True or false? Oh, you guys are smart. People younger than age 65 can get Alzheimer's. True or true?
Dementia is the umbrella term for an individual's changes in memory, thinking, or reasoning. There are many possible causes.
Can you turn that up?
And Alzheimer's is the most common cause. Other causes of dementia are vascular dementia, which is marked by changes in the blood flow and the blood.
You know what? I'm going to start this over. I want you to. Thank you, Denon.
Dementia is the umbrella term for an individual's changes in memory, thinking, or reasoning. There are many possible causes of dementia, and Alzheimer's is the most common cause. Other causes of dementia are vascular dementia, which is marked by changes in the blood flow and the blood vessels in the brain. Dementia with Lewy bodies, identified by specific brain changes throughout the brain that include the buildup of a protein known as alpha-synuclein. And frontal temporal dementia, which is marked by brain cell loss in the front sections of the brain, or the frontal lobe. Each type of dementia may have distinct characteristics to cause specific behaviors in the individual, but there is also some overlap in behaviors among the types of dementia.
There are a lot of people who have a mixed dementia. They have a couple of different types of things that are affecting dementia. And one of the things that's important to remember is that, like most chronic medical conditions, there usually isn't just one biological process that causes the disease. With dementia, it is usually multifactorial. It is affected by people's lifestyle, people's exercise habits, people's cardiovascular health. What I'm reading more and more about is that they're saying that there is a really extreme connection between your head and your heart, and that if your heart health is impaired, your brain health is going to be impaired. I mean, that really has to do with the blood and the oxygen flowing to your brain and driving your brain. And if you don't have enough blood and oxygen going to your brain, your thinking is going to deteriorate. So the cardiovascular, actually, they did a study and looked at autopsies of people's brains, and they said almost 80% of the autopsied brains that were diagnosed with Alzheimer's had cardiovascular issues as well. So it's not cut and dried. It's important to remember the cardiovascular stuff. Also, diet is really important, how we live our life. There are a lot of factors that affect our biological functioning. Drinking and drug use, that stuff affects the brain. So an accurate diagnosis is critical for getting the care you need, and for making sure that you're treated for whatever is going on if it's not dementia. So dementia is a general term, she said, an umbrella term for a cognitive collection of symptoms that are severe enough to interfere with daily life. So people say, well, he has dementia and he doesn't have Alzheimer's. He has Alzheimer's and he doesn't have dementia. Dementia is the broad category. It's a word that means away from the mind. People are losing their cognitive or their mental skills. And then the specific disease, Alzheimer's, have biological processes that are going on that are causing the dementia. In some ways, this is like saying, I have an infection. Well, an infection isn't really a disease process. An infection is the end result. Does that make sense? And dementia is the end result, but there's a disease that causes the dementia. So Alzheimer's is the most common cause of dementia. 60 to 80% of dementia is considered to be Alzheimer's. And again, it's not a normal part of aging, it's a progressive brain disease.
More than 100 years ago, Dr. Alzheimer described specific changes in the brain, what we now call the formation of plaques and tangles. Alzheimer's is a progressive brain disease that's marked by these key changes and impacts memory, thinking, and behavior. The brain has three main parts: the cerebrum, the cerebellum, and the brainstem. Each one plays a role in how the body functions. Alzheimer's disease causes nerve cells to die, which leads to brain tissue loss and causes loss of function and communication between cells. These changes can cause the symptoms of Alzheimer's, such as memory loss, behavioral issues, problems with thinking, planning, and at the end stage, swallowing.
So risk factors. Any guesses? No, family history is kind of what actually happens. The thing about genetics is that you can have all of the genetic makeup that might lead to Alzheimer's, but it doesn't mean you're going to get Alzheimer's. So a lot of people, actually a couple days ago I read something about 23andMe, and apparently they're having people send in saliva samples, and they're telling people about their genetic background, and I think probably scaring people half to death. Because just because you have the gene doesn't mean you're going to get the disease. So I don't want to know about my genetic background. I mean, I figure I'm going to go forward, and what's going to happen is going to happen. And I think thinking that I have the gene is not going to make me a whole lot happier. I don't know. Does anybody see that differently? Okay, yes.
So now I'm like, okay, what can I do to make sure that I have all my bases covered by exercise?
Yes, okay. So that sort of helps you to feel a little bit more motivated to do what you need to do, because you say, okay, maybe there's a higher risk because of the genetics. Doesn't mean that you're going to get it. But age is the biggest risk factor. The older you get, the higher the incidence of dementia. At around 65, it's about 5%. Around 85, it's about 35%. So, but 35% is significant. That's a lot of people. Genetics do matter, but they don't matter primarily.
Alzheimer's disease is marked by specific brain changes that result in the clinical changes in individual experiences. That is, changes in memory, thinking, or reasoning. And ultimately, Alzheimer's is fatal. The exact cause for these changes is unknown, but there are some hints as to what may contribute to an individual's risk. Age is the greatest known risk factor for Alzheimer's, and when we look at populations of people, we see an increased risk over the age of 65. However, Alzheimer's is not normal aging. Family history is also a known risk factor. Research has shown that those who have a parent or a sibling with Alzheimer's are more likely to develop the disease, and that risk increases if more than one family member has Alzheimer's. When we talk about the genes involved in Alzheimer's, there are two categories that could potentially be involved: risk genes and deterministic genes. Risk genes increases an individual's risk for developing the disease, but does not guarantee that they will develop Alzheimer's. Deterministic genes, which are rare for Alzheimer's, guarantee that the person will develop the disease.
It's less than 1% of people who have the deterministic gene, and a lot of it is sort of clumps of people in different communities around the world that come from sort of a particular gene pool. So populations at risk: Black Americans are twice as likely as white Americans to have Alzheimer's or another dementia. Hispanic Americans 1.5 times more likely to have the disease. And almost 2/3 of Americans living with Alzheimer's are women. Now, I kind of wonder, why is it that Black and Hispanic populations like have such a higher incidence. And my understanding is that part of it is that there are a lot more cardiovascular issues. Going back to the cardiovascular health. So it is not just the genetics of the dementia in those populations. It more has to do with sort of other significant medical comorbidities and issues. So the stages of Alzheimer's disease. You know what, I'm going to skip these videos because our time is flying by too quickly. The stages of Alzheimer's disease are, first of all, just asymptomatic. People don't have any symptoms, but what they're discovering is that realistically, the neurodegeneration that's going on in people's brains starts up to 20 years before any symptoms show up. So the plaques, she talked a little about the plaques and tangles. The brain starts to get, I'm not a medical doctor, so I give you a disclaimer that we've got a medical person here. If you need to straighten me out, I'm open to that. But I think of it as that the brain is getting clogged up and the connectivity between the brain cells are communicating all the time. I think of this as like a long distance, back in the day when we had long distance phones and we were in Europe and we were trying to make a phone call and we're like, are you there? Are you there? Oh, it's on, it's off, it's on, it's off. That connectivity in the brain is affected by the plaques and tangles, which kind of plug up the system so that the brain isn't able to send the impulses that need to be made to work well. Zip along here. Okay, and so and then there's mild cognitive impairment. And mild cognitive impairment is a relatively new term. As a medical person, do you remember when that term started to show up? I mean, I would say in the last 10 years. It's new. It's very new. And what it means is that most of us, as we age, forgetting is kind of a normal thing, but there's a point where forgetting causes increasing dysfunction in your life. And with mild cognitive impairment, people are still able to drive and work and run their lives, but their family and friends, and I think this is sort of the insider view that I'm suggesting I want you all to start to have, is that the insiders who really know a person, they know when something's wrong. Don't you know when something's wrong with people you know? You know, it's not a mystery. And somehow we sort of act like it's a mystery, like, what? He is what? And I mean, I think about when we're with babies. I mean, all of you people who have had babies in your life, you can look at that little baby's face and you know in about a nanosecond that there's something not right, can't you? And with older adults, it's the same thing. I mean, I want you to really take your instincts seriously. You don't need to be a medical person. I mean, I'm not asking you to get out there and be diagnosing people, but I think we need screeners. We need people who say, there's something wrong and we're going to try to get you some help. So mild cognitive impairment is being diagnosed more and more. And it means that people are just having sort of an increasing incidence of ability to remember. There's amnestic mild cognitive impairment, and then there's non-amnestic. And the people who are non-amnestic are having a little more trouble managing complex tasks. Their brain is really just not able to engage in complex reasoning the way I used to. But it's not severely dysfunctional. So it's very difficult to diagnose. I think it's very difficult for doctors to diagnose. But a certain percentage of people with mild cognitive impairment are going on to Alzheimer's disease. And it's really good to start investigating early to see whether maybe there are the plaques and tangles in the brain, to do brain scans, to see a neurologist, to make sure what's going on in your brain. Because mild cognitive impairment can be from many things. I mean, alcohol and drugs. I mean, my guess is all of you know somebody who has a problem with alcohol, and it does not serve the brain well. And so people are starting to show mild cognitive impairment due to other things. But the people who have the plaques and tangles starting, it's good for those people to get assessed early on and to talk to a doctor about what can be done. Now, the reality is at this point in history, we do not have any treatment. There's nothing you can take to really, put a medicine in you to prevent it. There's nothing that you can really take to cure it. There is no cure at this point. But there are medications, which I'll talk about briefly later. But the earlier that you start exploring the options for medical treatment or clinical trials, getting involved in clinical trials at the major universities that are doing the science and the research, the better. I mean, when I think about if I get Alzheimer's, I think I would want to be in a clinical trial because it gives you hope that maybe you're going to be getting something that's going to, sooner or later, one of those things is going to work. But this, this is something that I think it's good for people to think about, that you have that option if you get in early on. The medicines that are being approved are really approved for mild cognitive impairment and early Alzheimer's. Once you get past a certain point, those medicines are not going to do what you want them to do. So the earlier, the better. And then moving along to the dementia due to no, wait a minute, I'm sorry. Then mild cognitive impairment is people are just forgetting information like appointments, conversations, recent events. Then we're going to move on to the early stage or mild dementia due to Alzheimer's, early Alzheimer's. So really by then you need to have seen a doctor, have a brain scan. A brain scan is going to show what's going on in there, and you can get more information. They can also do other testing that is helpful for clarifying a diagnosis. But in the early stages, the symptoms that interfere with daily activities or problems coming up with the right word or naming things, people end up using stuff and thing and just not remembering what the right word is for things. Trouble remembering names, we all have that. So again, this is more extreme. Difficulty with familiar tasks. People who have cooked a recipe 1,000,000 times, all of a sudden they say, man, I don't know what goes in that. And I don't know how to use my telephone anymore. Forgetting something that was just read, getting lost in familiar places, and increasing trouble with planning and organizing things. Just basic running your day-to-day life are things that start to show up in early Alzheimer's. Then the middle stage, and again, people sort of want to say, well, what stage am I in? The reality is that every person is different. Every person has different symptoms, and that knowing what stage you're in, theoretically, is not going to make a huge difference in kind of how your life is managed or the care you get. Some people get very attached to saying, well, I need to know what stage I'm in. And, it's helpful. It's helpful to know how serious it is. But what's most important is figuring out where the person is having deficits and how we're going to compensate for those. That's a lot of what I do in my work. I work with family teams, doctors, and patients to really say, okay, who are you? What kind of life do you want to continue to have? And what do we need to do to kind of recalibrate your life to make it doable? Downsizing a house. People go from a great big house to 3 stories to maybe a 1-bedroom or 2-bedroom condo that's on 1 story. People take 90% of their clothes out of their closet so they don't have to make all of those choices. People who have photo albums, I say make 1 photo album, put names of the people you love on those photos, and put the other ones in storage, because just another photo album isn't going to do any good. So understanding the stage doesn't really help a lot with making decisions about the ongoing care plan of how you manage someone whose thinking just is not working very well, and so they're not going to manage their lives. So as an outsider and family and team, what we work on is setting up things in people's lives that are doable, things that really matter. I don't know if any of you have seen the video called Alive Inside, and it's about the use of iPods and music for people with dementia. If you're looking for something great to watch on Netflix, It's called Alive Inside, and it is brilliant. And it's about the use of a playlist of people's favorite music. I mean, think about right now, what's your favorite song? They ask people what their favorite songs, and they download music onto an iPod, and they put headphones on people. And the part of the brain that deals with music, that has music and connects to memories, connects to images, connects to dancing and body movement, all gets triggered when people are listening to music, and external things are all cut out. So it's a brilliant treatment strategy for people, especially as their Alzheimer's is pretty progressed and they're really not able to engage in much activity, to listen to music, that brings back the past. It also allows people to start having these old thoughts and to start speaking more. So Alive Inside, watch that video. You will weep and you will love it. So the middle stages of dementia, people forget events from their own personal history. People start forgetting more of their past. Early on, people remember their past, so part of how you can work with people and communicate with people is to talk to them about things from their past that they love. But as people progress into the middle and later stages, that past memory starts to deteriorate. So what you see is that oftentimes people feel more frustrated, angry, and withdrawn because life is just too much of a challenge. And so they just don't want to get out there and get involved because they become overstimulated and they can't figure out what to do. So that's very common in the middle stages, is that you see sort of emotional deterioration and anxiety. Confusion about date, time of the week. People don't know where they are. I know my own dad had cognitive testing, and they said, oh, he wasn't that bad, but he didn't know who the president was, and he didn't know what year it was. And I said, that's pretty bad if you don't know what year it is. So that kind of confusion. Trouble controlling bladder and bowels, trouble with choosing clothes, changes in sleep patterns, higher risk of wandering and getting lost, and personality and behavioral changes. And about 50% of people at this stage start to have some kind of delusions or beliefs that people are stealing from them because they're not remembering where their stuff is, and so they think it's lost. It's sort of a natural progression of thinking. If it's not here, somebody else has got it. And that becomes a difficult issue for caregivers, is dealing with that, because the belief is real. I mean, their belief that it is stolen is as real as this. My belief is that I have this piece of paper in my hand. You'll never convince me I don't have this paper in my hand, and you'll never convince a demented person that someone isn't stealing. So you gotta go around the back door, and you gotta move the conversation to something else. Put on people's music when they get into that state where they're suspicious and paranoid. And then in the late stages, people really lose awareness of their surroundings, so they really are just kind of in the moment, in their mind. They're not really connected to what's going on around them. People go through changes in physical abilities. A lot of times people can't walk, and they lose interest in eating, and swallowing, as she said in the video, is the kind of an end result. People have a lot more trouble communicating, and the communication is more nonverbal, so you've got to learn how to read people's nonverbals just like you do with a baby. And you can do that, but you have to sort of give yourself permission to communicate in that way. People have a lot higher incidence of infections and those kinds of things. So just quickly, on to the medications. There are medications that have been used since the early 90s, and some people say that they think they're placebos, and other people say that they think they've had some success with them. But the medications, let me see. The first medications really are meant just to treat the symptoms. There have been no medications that go after treating the plaques and tangles or the biological pieces of the disease. So they treat the symptoms, they treat the memory problems, and sometimes people's thinking is a little bit clearer, their memory for things is a little quicker, it speeds up their thought. And usually it is helpful in the kind of the early stages of the medicine if it helps. You know, I would say that more doctors than not that I have seen here tend to prescribe these medications because it gives people a little bit of hope early on. And this is a decision that people just need to make with their doctors about kind of how they're going to go forward. There are several new medications that have come out in the last couple years. One is called aducanumab, and the next one is called lecanemab. That's not on there. It came out within the last year. And they both are approved by the FDA. They were approved pretty quickly, and they are different than these other medicines that treat the symptoms. These go after, they're called anti-amyloid, and they go after the amyloid, the clogging of the brain cells, and they go after that. And, you know, there's a question about whether it's helpful. This is a conversation that only you can have with your doctor. It costs like $25,000 a year, and there are a fair number of side effects, and Medicare doesn't cover it. So, you know, we're moving forward. New medicines are coming on board. I'm optimistic that sooner or later something's going to come along that's, you know, going to maybe solve this problem. Like polio went away in overnight. So, anyways, everybody experiences Alzheimer's differently. The symptoms are different. The treatments you have to work out with the people around you and your medical team. But again, I think that it's super important to take seriously your symptoms and the symptoms of people around you, and to step in and to get people to see medical people, to be evaluated, and have some recommendations made about how to go forward. And that might just be improving your lifestyle, like you were talking about, improving your diet, exercise. I mean, people who live in this community, I mean, we got a lot of us have a leg up because we've been exercisers for years, and that is so good for cardiovascular and brain health. Okay, well, so my time is up. We've gone overboard. Is there anything that anybody wants to ask? Just quickly. Any questions, comments?
Participating in
Feedback.
I'm participating.
I really like the idea that you emphasize being diagnosed. Is that something my medical doctor can do, or do I have to go to a neurologist?
You know, I would say ideally you go to a neurologist, but getting into a neurologist is a gigantic challenge. You know, if you're willing to go to Twin, if you're willing to go to Boise, or if you're willing to wait. It's very difficult. There are medical doctors, primary care doctors, and some of the concierge doctors. I've seen people who have just been diagnosed, and you know, personally, I say, why not do the requisite testing to make sure? You know, I just don't think this is one of these areas in life where you want to guess.
But I thought you implied that if we go to the doctor for our annual Medicare, we could get a cognitive test.
You can. They have one.
Okay.
They have one.
So we
ask
just need
for
to
it.
ask.
You need to ask. You need to ask. You know, we need to help the medical profession step into this. I feel for them because once they have a patient in their caseload who has dementia, I mean, I see a lot of people who don't have any family here, they don't have kids, they don't have a partner, and now they have a diagnosis of dementia, and the doctor looks at them and thinks, wow, like, what are we gonna do with this person? But, you know, I think this is part of why our community, I mean, I think our community has historically wrapped its arms around people and really helped people out and taken care of remarkably well, given the lack of services. But I mean, I say, if a miracle happened in this community, what would you want it to be? And I would say, you know, get a big senior community facility and extended services and a geriatric assessment center. If anybody super rich is listening on this live stream and wants to talk about how to get that going, because, I mean, I don't have kids and I'm divorced, and I think if something happens to me, I don't know what I will do. You know, somebody will have to come and get me and move me. And I don't like that idea. I like the idea of staying home. So these are, you know, this is a very complex area, and it's something that I think we all have to be courageous about, and we have to be willing to think about. We have to be willing to talk about it and to explore openly and not be so scared of it, because being scared of it and staying away and doing nothing is really the worst thing you could do. So, thank you all for your interest and participation.
Thanks very much, Dr. Carroll. Don't forget, we have another talk coming up on June 23rd, I think it is. June 13th. I was almost right. So I forgot. Half right.
I'm thinking ahead of time, if there are questions that people have or things that you want me to talk about, feel free. I'll put some of my cards out here. Feel free to send me an email and just make suggestions, because I want to be helpful to people, and like I need your help in knowing what you need. Is a cognitive assessment the same as a memory test? A cognitive assessment, well, it can be as little or as big as you want it. The cognitive assessment in a doctor's office is a very tiny assessment that takes less than 5 minutes. It is a memory assessment. They assess your immediate and short-term memory. They will give you some words, they'll give you some things to remember, and they'll ask you those later. And then they have you do a little diagram that requires your brain to kind of think and plan and organize and do a little bit of a complicated task. And so that's what they do in the doctor's office. It's not an extensive test. I mean, you can go see a neuropsychologist. The neuropsych testing can be 4 hours, it can be 8 hours. I mean, I've seen people who go to a neuropsychologist and they have an IQ test, which is completely unnecessary. You know if you're smart or not already. You don't, I mean, at a certain point, you got that piece nailed down. But understanding, the more extensive cognitive testing is more important for younger people, like people who have had head injuries, people who have been in a car accident, people who have had a stroke and are really needing to be rehabbed. So they want to see where exactly is this person cognitively? How is their thinking? How's their memory, problem solving, ability to name things. So they don't have to do a ton of it. I mean, it's an assessment that is relatively simple. It's a screen. I mean, I would say that it's a memory screen that they're doing at the doctor's. Just like your weight is. Your weight is a screen of, what's going on. If you're having cardiac issues, maybe it's a screen that your heart isn't pumping well enough and you've got too much fluid in your system. So, that screen is informative of next steps. So ask. Be courageous and tell them you'd rather have them give you a memory test than put you on the scale. That's right.
Or take 10 pounds off.
Yeah. All right. Yeah. Yeah.
So thanks again, everybody. Please take a couple of minutes to fill out that survey. There's a box you can drop it in on the table. There's also a pencil there if you happen not to have a pencil or pen with you. And thanks again for coming.